Hello. Hi, everyone. Good to see everybody.
Hello.
I see Rebecca. Hey.
Hi. Hey, everyone.
Awesome. So people are trickling in. Yeah, but nice to see some new faces. And yeah, so we are, for those of you that don't know us or haven't met us yet, we are the Crohn's and Colitis dietitians, and we do free webinars every single month on topics that people ask for. And so this is another one of our monthly webinars, and we're happy all of you could be here. This is our first one that we've left kind of open and interactive, where people can just come in and ask questions. And we haven't done one of these yet, but everyone has had really great questions so far. So I'm excited to see what comes up. Rebecca, did you want to say anything?
Well, first off, it's nice to see some new faces and some old faces. And I'm really excited to just be here with you all today and just kind of keeping it an open discussion, because I thought, we thought that might be good to look into. Just, no specific slides, nothing like that, just really open-ended, anything that we can kind of help you guys with.
Yeah. So feel free to, if you want to speak your question, you can, or if you'd like to type it in the chat, just whatever is more comfortable for you. And this could be questions about IBD or questions about IBD nutrition, anything.
Hi, Ashley. It's Shoshana. How are you? I'll start.
Hi.
Hi.
I'm good. How are you doing?
Not so good. So I'm calling about my daughter who has colitis, right? I'm checking in. She's actually in Emerge right now. Yeah, we're having not a good day. So I'm not in good mode. My husband's there, but I'm actually going to ask a couple questions that maybe you guys have answers. She's 18. She has not had an easy time, and now it's going into the holidays, so nobody's around. It was already hard with healthcare. She was not on antibiotics before in the hospital, and she caught C. diff. She has colitis. So she was actually put on a very strong antibiotic, and like a 14-day, I'm sure you both know, like probably it's called vancomycin.
Yeah.
For 14 days. And now on day 10, she had major kind of like in the breastbone, like chest and stomach, major pains, like throbbing on Monday. And then today throbbing again, vomiting, ends up in Emerge. We don't know if it's the meds, the C. diff, a flare. Like there's so many things. We don't know if she's going to have to be admitted. There's so many unknowns and like hours in the hospital here, which is, she already has anxiety of that. But have you ever heard of this? Or like first of all, I mean, everyone keeps questioning her. Why do you have C. diff if you weren't in a hospital or on antibiotics before? But her GI doctor, who's now on vacation 3 weeks, said, well, IBD patients can be more prone, unfortunately, to C. difficile, which we didn't know that. So I don't know if you have any words on if you that medication or these kind of symptoms or C. diff with IBD. Like, I don't know. It's been very bad week. Very bad. Yeah.
Yeah. First of all, I'm sorry you're going through that. It's so hard to be in the hospital, but also to have a family member in the hospital, especially with all the unknowns. So especially and during the holidays too, at that. So
yeah.
I mean, we've had a few people on vancomycin before. I've actually been on vancomycin too when I had an infection. It is one of the like more difficult, more intense antibiotics. So people can have reactions to them, and it just can be one of those tough antibiotics to get through. And usually if people are having a hard time with it, they might swap it out with something different or, it's hard to say really. I don't know what's going on, but yes, I have had some experience with vancomycin. what is the concern now with Vanco? Is it
Well, the
mostly?
question is it from that? Is the C. diff healing? Is like, why did it happen 10 days in, right? Shouldn't have a reaction on day 1 and 2. That's my question, because I'm the big advocate, as you know, and I'm on top of these things, and I read a lot and I go on workshops a lot and I try my best, but there's just so many unknowns with these things. Like, why is it like, you know, some of the blood counts have come back up for sure. They did blood, and I knew it would. I just had a feeling. But it's still these unknowns, like what else is going on to make her in this much pain that she's never been in her life ever, or we would not have called 911. Like, I've never seen her like this. It's so sad and tough, you know, and it's very hard because she's first year university and she just can't have a normal year. She's never sort of regulated, like it's just always something. So it's not easy, not easy. Yeah. And this is just like cream of the crop, right? Like it's always some bad days, but now like this week's obviously to the extreme of emergency. Yeah.
Yeah. So it's like, it's chest pain, you said?
Well, it like she called up into the chest, but also in the middle, like upper abdomen, middle of the chest, sort of like throbbing, right? So then the question is, well, where is it coming from? Is it, what's the word? Like, not resonant. Is it like move it? Like, where is the source, right? I guess that's what I'm trying to say. And we don't know. And I don't know how they'll know, to be honest. I don't know.
Yeah, I mean, that's tough. I mean, it kind of is hard to say. Well, the good thing is that with vancomycin, yeah, usually, like you mentioned, reactions are typically, you know, right off the bat. Like I knew in the first few hours that it wasn't going well. Even the first few minutes sometimes. So if it was reaction related, you would think it would be, you know, more in that first
Usually,
part of having it. Yeah,
you would think, but I don't know, right? There's so many unknowns. I don't like unknowns, being
Yeah.
honest, right? It's harder when you don't know what's going on. So much in question. And this is the second day of these emergency pains. So this is where we're at. I popped on anyways today, but you know, it's a lot of unknowns and not a lot of support. And, you know, she was on a new probiotic for a few days without anyone guiding her. I've told you guys before, she gets no guidance on diet and nutrition or you know, IBD nutrition or probiotics. It's just like, yeah, if you want, yeah, this. Like, she's really had no support except for medication from her GI. And now she's trying to transition to an adult doctor, and the referral fell through from 6 months ago. So a lot's been going on. It's not easy. Not easy. Yeah.
Yeah, I mean, I guess she's in the right place. So she's having chest pain and, you know,
And
it's like-
abdominal.
yeah, it's good to be near people who can start to kind of sort through and like try to get to answers.
Right.
I've definitely been there before, in the hospital where it's like there's always an unknown and there's a new person each day, and it's trying to like, it's very hard to advocate for yourself and to also be dealing with all of this too.
So hard. Yeah. The advocating's hard, you know, it's just, you're right. It's a tough one, you know, and when you have anxiety on top of it all, it makes it just like 10 times harder. Right.
Yeah.
Yeah.
Yeah, definitely. In terms of advocating for answers, I mean, I'm thinking they're probably already running like the lab work that you would need to run to figure out the pain, like, you know.
Well, they're not going to just do a colonoscopy or MRI these days with the healthcare the way it is here. They're just not going to. Like, they could send her home and she could have more of these episodes and say, oh, wait to get some testing, which is not good either. That's very, you know, scary.
Yeah.
Wait for some tests. So, you know, I don't think they, like, I know they're not going to just do a colonoscopy today. You have to prep for that. Nobody's going to just all of a sudden, and she hasn't had one in a year and a half. So, yeah, it's a lot of unknown right now. A lot.
Are they running like tests to see how the inflammation is? Like,
so tell me what type. You mean blood work? They did blood work and an ultrasound so far. We don't have all that. That's about it so far. Anything else that would show inflammation besides a colonoscopy?
CRP, sed rate, fecal
Oh yeah, the
calprotect.
blood work. They checked on that.
Yeah,
It's up. It's up.
it's
The
up.
CRP
Yeah.
is high. Yep. The
Yeah. I mean,
CRP
that
was
makes
high for sure. And I'm not surprised,
Yeah.
unfortunately. Yeah.
Hmm.
Scary stuff. So anyways, this is where we're at. It's just not easy times. Yeah.
Yeah. Rebecca, do you have any insights on that, on how to advocate yourself in those tough spots and try to figure out answers?
Shoshana, I'm really sorry
Yeah.
that you and your family are going through this.
Yeah, thanks, Rebecca. I know you both understand. A lot of people do not, but I know you both do, and it's very tough time. It's not easy. It's very scary.
Yeah. You know, anytime that so C. diff can definitely be very, very, very hard to treat.
Wow.
It can be very resistant, and the FDA actually just recently approved fecal transplants. Depending on like how it's being used and with antibiotics. But yeah, I mean, depending where you're located. But the thing about C. diff, yes, it is pretty hard to treat at times because it can be a very resistant bacteria. But it doesn't mean that it won't, it won't be healed, right? Like it doesn't mean, I mean, I've worked in multiple hospitals and people came in with C. diff all the time and people left testing negative for C. diff. So, it is a common bacterial infection, and that's why people that you knew had said something, where did your daughter catch it, so forth, in a hospital. And so having IBD, yes, it does make us a little bit more susceptible to catching bacteria. As far as the vancomycin, yes, it is a strong antibiotic, and any kind of new symptom, I would just really talk to the doctor and say, this is what my daughter's experiencing. Does she need to have an echocardiogram since she's there? Would that be something good to look at just to make sure? Just kind of, is this a common side effect to this medication? So really, talking to the doctor about the medication that she's on, since that's kind of the newer variable in this scenario. So I would just kind of ask about that. But yes, Vanco is used to treat C. diff, and other causes of C. diff could be certain antibiotics that are used. So Cipro,
Right, which she wasn't on.
Right.
So that's, there's so much unknown here. We just don't know.
Yeah. And I mean, you can easily kind of pick it up if, let's say you're in a restroom, right? And just so happens, right, it could be like the perfect storm. So whether it be from that, or maybe she knew somebody that had it, but it's just, it's really hard to determine the root cause of something, right?
I know.
It's really hard. As far as the chest pain too, something that I just want to mention is I have read before that sometimes with ulcerative colitis, when you're in a flare up, a fast heartbeat could definitely be present. And I have also seen, just like, it's not just only in the gut, but there could be other things kind of going on simultaneously. So kind of but nothing, obviously it's nothing to, I'm not trying to concern you or anything like that. It's just, she is in the right place. Like Ashley was saying, she's in the hospital. That's the best place that she could be right now. And just staying on top of it with her doctors and just understanding the medications, common side effects. Is this a side effect that she's experiencing of the medication? Can we switch to a different antibiotic that's just as beneficial as the Vanco? So I would just really suggest to explore your options and just continuously staying on top of your daughter's treatment, which just sounds like that's what you're doing. So yeah.
We're trying. It's just sometimes hard. Sometimes there's easy answers, and sometimes it's like, very hard to get to the bottom of certain things, or, with the busy healthcare system, it's just hard to get answers, and that's frustrating. Yeah. But we'll try our best. So thank you.
Shoshana, I wanted to, we have helped some people with recurring C. diff before. And I know there are some probiotic strains and certain prebiotics that can reduce the incidence, including some like food-based approaches, that I can send you over maybe the research that there is on that. There's maybe a few
Sure.
different options,
Yeah.
and some I think would work better with colitis than others. But just so we need to do an article or a blog on that topic.
Yes, that's a big one. If you could, but sure, send it
Yeah.
over to me. Sure.
Okay.
Thank
Yeah. Yeah, that's a good topic. And I'm
Yeah.
sorry to hear that all that's happening.
No. No.
All right. Does anybody else have any questions or anything you want us to kind of chat about? Hey, Rachel.
Hi, Rachel.
Hi, can you hear me okay? My connection's not great, but
Yeah, I can hear you.
good. So my question is about anemia and iron, which I was low 3 months ago, and I just had it checked again, and I've been supplementing somewhat, not very consistently, and now I'm even lower iron to like where I'm really feeling it symptomatically. So I'm just curious. So my doctor prescribed like a iron supplement. So I'm doing that twice a day now. I just started that like within the last few days. But I'm just curious, like, this is the best my Crohn's has ever been. Like, I'm not in a flare up. I haven't been in a flare up. You know, my diet's been really good. That's helped so much. And so I'm just curious why my iron would still be like going down, or, you know, like it's even gone down in the last 3 months. So I'm just curious about that. And also what you'd recommend diet, like through diet to also help.
This is interesting because Rebecca and I just got back from an IBD conference, and we learned a few things. Well, stuff that we've seen before, some of it, and some new things around iron. But one of the things as to, you know, why it could be getting low is that, so when you have inflammation, your liver, you actually utilize more iron, and you also have the action of some things that happen in the liver. So your body produces something called hepcidin. It also does this after exercise, any sort of inflammation, and that sort of blocks absorption of iron. So that's one reason why people can kind of stay low. If the ileum is inflamed, that's another reason why it can stay low. But biggest thing is inflammation. Inflammation is the things that'll drive both iron and vitamin D lower. If you need to troubleshoot it all, like with iron, like there are some things that you can do to kind of help. Rebecca, do you want to talk about like that, the research that newer research that came out around iron supplementation?
Yeah. So the thing too, also, Rachel, is that, you know, anytime there's also surgery involved, you know, like if there's any kind of surgery, that could definitely affect any kind of absorption, right? And so that's kind of important to consider just based off where iron is being absorbed. So that's kind of something that my brain's kind of floating around there. And then the other thing is, yeah, like Ashley was mentioning. So as far as iron goes, it's actually better to take your supplement every other day, right? So you don't want to take it consecutively every day, because it's actually it's beneficial for absorption reasons if you do it every other day. So you are absorbing more than you would if you did it consecutively. And then the other thing that I'm thinking about too is if you're consuming foods that could possibly inhibit absorption. So, you know, are you taking iron with your breakfast? Are you taking it more so on an empty stomach? What's kind of going on with that?
Yeah, I'm doing it on an empty stomach.
Okay.
And the only thing I mean, through my own research, like black tea apparently blocks absorption. So I usually do drink tea in the morning. So I'm keeping it away from that. So I'm moving more towards, I mean, the prescription, so to speak, is 2 times a day. So interesting, like you're saying, every other day. So I'm not sure how to manage that part of it. Like,
If you do it every other day.
yeah, should I just take one of the tablets every other day, you think then?
So how many tablets are you supposed to take in total?
2 a day, but I can't remember what dose it is.
Yeah, so I would take it every other day, or
Okay.
even a couple times a week, just so that you have better absorption.
Okay.
If that doesn't help, sometimes liquid iron is a little bit better too. So
Yeah, I think you had talked to me about the Floridix.
yeah.
I had a hard time like keeping up on that for some reason. But
Okay.
do you think that really is better absorbed than like the pills that I'm taking?
So it's really hard to say because, I start questioning what's the brand that you're taking, what is it, what's the strength that you're taking. I've seen a lot of, at one point I was pretty anemic, and I tried different types of iron pills. Some of them just really bothered my stomach. Other times I just didn't really like it, and so I tried the Floridix, and it was just easy for me to take down, and my saturation levels significantly improved. It was like a very quick turnaround, which is really awesome. And I've also recommended it to our other patients, and I've also seen really good results from it too. But doesn't mean that everybody is gonna, it doesn't mean it works for everyone, right? And so I just like to really recommend it because there's not a bunch of additives or preservatives that are in the liquid form, and it's just easier, and
Yeah.
just maybe something to consider. Yeah.
And could I take that twice a day, like the little cup? Like,
Yeah. So depending on what your levels are, your hemoglobin and also your iron. So if obviously if hemoglobin is low, your doctor should be considering an iron infusion if it's on that borderline level. So you want to
yeah.
keep up with that. Check it every few months or so to see where you're at. See if you're also responding to the supplement. But depending on where you're at with your levels, I would really suggest either just doing once a day, the 10 mLs in the cup, just take it in the morning and just kind of see how that goes. And if you need to
Okay.
bump it up to 20
Hello.
mLs.
How are you? I'm okay. How are you?
Okay.
Okay. Is that helpful?
Yeah, it's definitely helpful just to
Okay.
talk it through, and I can try the Floridix again, and because I do have a sense that it's going to be more absorbable somehow if I'm already having trouble absorbing.
Mhm.
So yeah, I think
Yeah.
I'll try it again and just see.
Yeah. And just kind of switch it off and on, from the days that you're taking it.
Yeah.
I want to add one more thing, and then I saw someone had a question, but with iron, another thing to keep in mind is that different types of iron have different absorption levels. So it doesn't always equate like the same dose to the same different type of iron, because there's what's called like elemental iron, which is the part that it really absorbs. So keep that in mind. Maybe talk with your provider about if you do swap, like try to see what dose they would recommend. But yeah, the research on it is like skipping a day or two. You could probably even look it up and bring it to your doctor, but it would be like the main dose that you're taking and then skipping a day or two and then taking again. And it just kind of improves like the sensitivity to absorption. And you can also do that around exercise too. Exercise will increase hepcidin, but there's this period like in the first 10 minutes after exercise where we actually do uptake a little bit more iron. So that's another thing you could try. And then there's also other things you can combine depending on what's causing you not to absorb. There are other ways that you could troubleshoot it, but I won't get into the weeds on it. But I would start with kind of what Rebecca was saying. I think that'd be a good place. And I think Tina, you had a question. So let me see if I can unmute you.
Can you hear me?
Yeah.
Okay. I'm sorry. I'm at work, and so this time is a little hard for me. But anyways, I'm going to try. You said any questions? Is that what you were talking about right now?
Yeah, I thought you had raised your
Okay.
hand or something.
I
so
did. I
okay.
did. Oh, I did. I was thinking, have you talked about diet or specific diets? Because I'm really struggling with my Crohn's right now. And I keep avoiding surgery. I just don't want to do that at this point. And so I'm just trying to figure out, the research out there is all over the place on diet. And I've even tried SCD. it was just so restrictive and I just had trouble keeping up on it. However, the beginning part of that, the initial part worked really well, but I just couldn't get past that. And I'm just, you know, I don't know what to eat anymore. I've actually gone to shakes. I'm buying some from a company that, I mean, I don't know if it's enough. I hope it's enough, but I'm still hungry, but it's just, I'm just struggling with what to eat. I'm tired of, you know, throwing up, you know, later, you know, when it goes through and obviously finds the areas that it can't get through.
Hmm. Yeah, that's tough. We did, Rebecca, do you want to, I'm going to look for that, that video that we
Yeah.
did on that topic.
Yeah.
I think one thing that I've realized over time is, yeah, there is a lot of research on IBD nutrition, but the great thing is that it is kind of consistent. Like there are some consistent themes throughout all of it that I think when you look at it as a whole, it can provide you a little bit more clarity and peace around it. So there are some consistencies that it is. The good thing is that some of the more restrictive stuff, there is less evidence for, less strong evidence, and some of the more like easier to incorporate things like starting to include more plants and, focusing in on omega-3s and all of that. Some of those things that are easier to stick with can yield pretty good results. But while I look for that, we did a topic on just what to eat. So I'm going to look for it and share it with you. But Rebecca, do you want to share some thoughts too?
Yeah. And so Tina, we did a whole webinar on what to eat for IBD and kind of what the research shows and what's recommended. But just to kind of give you an idea, first and foremost with Crohn's disease, it's important to know whether or not there's any kind of stricturing or narrowing going on, because that can definitely, so that's going to have to, that's definitely going to play a role in your therapy. I can't, right now give you specific recommendations for you just because you're not my patient. So I'm not legally able to do that. But generally speaking, just kind of giving an overall understanding of, Crohn's disease and IBD and nutrition. Oh, and I see Ashley linked us. So that's a really good place to start, just to kind of look at some recommendations. But just to kind of give you an idea, with IBD, it's just overall, it's important that, you work with foods that are well tolerated for you right now. And if that's going to be shakes, then that's kind of where you're at right now. But it's really important that you are progressing your diet as tolerated and really understanding what's working and what's not working for you. So I would highly suggest that one, you look at this link that Ashley just provided to everybody. And the other thing too is I would recommend you really speaking to an IBD focused dietitian. So there's a lot of dietitians out there, a few of them that do IBD nutrition. And, we can, of course, always help you as well. But whatever you're comfortable doing, I really do recommend, though, you working with somebody, whoever that person may be, because there could be some nutritional deficiencies going on. It's, depending on how many shakes you're consuming, how you're liberalizing your diet, what's kind of happening. So I strongly suggest having having that person with you.
Yeah, I'm happy to talk with you further too, if you want, like in a call, and we can kind of sort through if it's something that we could help you with. And if not, I'm happy to refer you to, we have a number of people we refer out to as well. So yeah, I think that would be a good place to start, but
Okay.
and then checking out the video.
Okay, yeah, I tried to copy it down. Because my major thing is I'm in California and I have Kaiser.
Mhm.
And Kaiser will send me to a nutritionist or dietitian, and they're looking up Crohn's as they're talking to me. And so it hasn't helped. And it's not their fault. They don't know. And so they're looking at the same, and I'm like, okay, I know more than they do. Not that, I'm not not belittling. It's just, and I know Crohn's, part of it is Crohn's is different for everyone. And yes, I have strictures, and I've had Crohn's for a long time. I've gone through a bunch of different medicines. I'm finally on a biologic, a shot, Humira. And they've added one more because that wasn't even enough. So I'm just trying to avoid surgery. I'm still working. I don't want a colostomy. And that, no one in their right mind is going to say, okay, don't worry about it. You can do surgery. You won't end up with that. They just can't do that. And I understand it. So, but the other side of it is Kaiser doesn't pay for an outside dietitian, which is my biggest issue.
Yeah. So we don't do insurance, but we also do some sliding scale and free scholarship options. So, we can talk about that if you'd like to maybe see if that's an option for you. So, because I know insurance is tricky. I tried insurance for briefly, and it's just, you don't get a lot of time with people, and they often don't cover GI or IBD. And so that's kind of why.
I never said interns. I said insurance.
Yeah, I was saying insurance too. Maybe I'm not.
I'm sorry.
Maybe I'm not enunciating.
No, I'm sorry. Okay. So, yeah, so sliding scale or, yeah, because I'm, you don't want to hear, I've got a whole different thing going on, but I'm literally at my age back to just renting a bedroom, because I've been through just a lot of stuff. And I know that's part of it. Anytime my emotions get involved, because I lost a husband, I lost a house, it's just, hold on one second. Yeah?
They're waiting for you at dental for the.
At dental, okay. I asked you guys, I thought you said they were gonna come tell me. Sorry.
No, I told you the time in the morning.
Okay, all right, I'm on the way.
Thank you.
I also remember what else. Sorry, I gotta go.
That's okay.
They're just, I'm also in a work environment that's not polite, not nice. So,
well, thank you for being here, and feel free to connect after the fact, and we can talk more about some options for you.
I'll listen to it. But let me just mute and stop my video. But yeah, it's just, I don't know.
Sounds like you're going through a rough patch for sure. It's been hard.
Yeah, I mean, but everyone goes through, everyone goes through stuff. So
yeah,
definitely, Tina, definitely reach out and listen to the YouTube video. Okay.
Yeah, I'm gonna do the, oh, hold on. I'm gonna do the YouTube video. The only thing is, and I copied it. I'm not quite sure how to reach out. I'm not even remembering the other issue for me, and memory is a big thing for me. I had brain surgery years ago, and I'm finding now that I'm older, over 50 and whatnot, and I think it's a lot to do with everything I'm going through. My memory is just shot, and that's causing a lot of problems too. So, yeah, I'm not sure how to get a hold of you guys.
I'll look for you on the sign up sheet and see if we can email you directly.
That would be perfect.
Yeah, and you can also reach out on our website. It's Crohn's and Colitis dietitians.com, or on Instagram too.
Okay, that's awesome.
Right.
I think I listen to you without people knowing it.
All right. Awesome.
Thanks for being with us today, Tina.
Thank you.
Thank you.
Rachel had a question. Could you mention some of the other iron blockers?
Like foods? Is that what you meant, Rachel? I'm wondering.
Yeah, exactly. You were asking me. The only thing I really know about is like the caffeine or the tea or something. So if you have any other suggestions, I'll pay attention to that.
Yeah, so things that have calcium. So calcium tends to lower iron. They kind of it inhibits iron absorption. Things like cashews, some nuts, oats is another one that can also inhibit absorption.
Zinc.
Zinc, exactly. Zinc decreases iron. So yeah, definitely like if you're taking, you don't want to take like your iron supplement and then a multivitamin that has zinc in it.
Yeah.
You want to do that. Some things that can help increase absorption will be things that are high in vitamin C. So let's say, you have your iron supplement and then you have like a piece of orange or something like that, that can help increase absorption. Some people don't like to take iron on an empty stomach. So if you have like a little piece of a banana, that's okay. It's just important never to really take it with a whole meal or just, or even like a moderately sized snack, because that can also inhibit the absorption. So yeah. I think
Yeah. Holly, go ahead.
Hey, just to piggyback on that, that was super useful. I'm actually taking iron supplements and zinc together in the morning, first thing every day. So would you recommend, so I'm thinking about, based on this, switching to taking iron like every other day, like you were saying. Is it okay to take like iron in the morning and then to take zinc, say in the evening with dinner? Is that give it enough space?
Well, I guess a question for you was, were your zinc levels low, or is it like
They were
prevented?
they were on the low side of normal, and it was my functional medicine doctor that prescribed zinc for me, and she did it at least partially because I am having issues with histamine intolerance, which is something I've had pretty severe issues with histamine intolerance, like so bad that it'll cause vomiting. And I have talked to an allergist, a functional medicine doctor, my gastroenterologist, and no one has any experience with histamine intolerance specifically. So that was, I have a list of a couple other things, but that was something I was wondering if you guys have any experience dealing with that.
It's funny that you say that, because that question came up in our group program today. We talked about like histamine intolerance and low histamine foods and antihistamine foods. Have you ever explored like nettle and pineapple and that sort of thing?
I can't eat pineapple at all. I get really bad reactions to pineapple. I'm familiar with stinging nettle. I've never actually tried it. There's another naturally occurring antihistamine that I was taking as a pill, but honestly, now I don't even remember what it is. At this point, I'm just taking diamine oxidase before I eat, like every single time before I eat, and that makes a decent amount of difference. But part of what's so frustrating about it is so much of what I hear that I'm supposed to be eating for my colitis are like fermented foods and things that are really good for your microbiome, but my body can't handle them because of the histamine intolerance.
Yeah, I mean, I actually, what I shared in CCR in our group today was that I get reactions to anything high histamine too, like particularly it's only the fermented like kombuchas and anything with alcohol. My lymph nodes will actually swell up. It's an interesting type of reaction, but I haven't found it too, for me, it's more or less just like vinegars and kombuchas and fermented things. So it doesn't cut out everything. Or is yours to the point where you feel like you have to do a little bit more than that?
Yeah, so I think it started that way. I noticed I had reactions to wine. And then when it was the most severe, I wasn't eating like no avocados, no tomatoes. Fish was really tricky because I had to find like really fresh frozen fish. So yeah, I feel like it's pretty restrictive in my diet. And I was trying to do the autoimmune protocol diet, which I did for 4 months, sort of with cheating because I was eating seeds. And I just found that trying to do that autoimmune protocol diet with the histamine issues. I just could not get enough calories. It was just impossible.
Yeah. Yeah, that's not too surprising. Like AIP and SCD, and a lot of them can, anytime you're cutting out like a bunch of different, food groups, it can have some
Yeah.
downsides, some in a lot on the microbiome too. And there is a connection with histamine intolerance, and there are some microbiome changes that can kind of escalate histamine intolerance. And we know with IBD, there's already these microbiome shifts. And so that being said, if you improve the gut microbiome and diversity, you can sometimes see improvements with the histamine part of things. So I think that's one place that I've started with people that are experiencing that sort of thing. And then bringing in antihistamine rich foods or stinging nettle, or kind of more that gentle approach. The downside with zinc is a lot of nutrients, it's like a balancing act. One affects the other. Some increase or decrease with inflammation. And so it is kind of this balancing act of which one do we want to focus on. Even if you were to take zinc and iron separate, there's still a chance that, one may kind of outweigh the other. So sometimes you may want to prioritize one over the other. So if your iron is very low, you may want to, is your iron like really low? Is it ferritin that's low?
It was super low. I just started on Humira 7 months ago. And so all of my labs have improved really dramatically in the last 7 months. Because I assume it's because of the Humira. At that point, it's impossible to tell, what improvements are coming from diet or lifestyle changes and what's coming from the Humira. But I just assume the Humira is doing most of the heavy lifting. So my iron levels are much better than they were. They were really low before I started the Humira, and my calprotectin was at like 3,000. But I've seen a lot of improvement over the last 6 months. So yeah, and also my zinc is in normal range too. So I don't know that either of those are super, super pressing.
Yeah, I mean, I would say, is the zinc within like a multi, or is it just zinc?
It's just zinc. Yeah.
Usually you don't want to go too long with any sort of mineral nutrient repletion. Once it's been repleted, you'll want to kind of avoid overloading with any of them. Like copper, iron, zinc, they all have some major downsides if they get too elevated. You can have all sorts of things come up, even selenium. I have seen people before that have eaten a lot of Brazil nuts in one sitting, and like on multiple times, because Brazil nuts are actually a great source of selenium. And one person came to me and she said she had done eaten like a whole bag of them, and she had ended up having to go to the hospital because selenium levels were so high. So stuff like that does happen. So you have to use some caution with mineral supplementation, including the brand and quality, because that's another consideration. Is it sounds like if you're probably in that space, you are looking for third-party tested options. But I would say overall, yeah, you may want to use some caution around overdoing it, and underdoing it can escalate a lot of things. So
yeah, I think part of my specific issue is I have so many doctors, and they're like all trying to do their own thing, and then it just all compounds to a ton of supplements.
I've been there. Yeah, I know. Yeah, I guess my only thought around that is like, see if you can pare down to what's important for you for right now, and avoid doing a lot of excess, because it's not harmless all the time. Just like with diets, how you know, when you read online about what to eat, if you Google it, you get every single link about what not to eat. And so then you start restricting, and even that, you would think that would be harmless. Cause I mean, I've thought that before, but it's not. It has everything we do kind of has some sort of effect. So taking that balanced, prioritized road, it's probably where you want to go. And if you have the ability to kind of pare down to, you know, 1 or 2 practitioners, that might help. Cause like, even with us, like, you know, for us, like when we have people with multiple practitioners, we'll usually request like, okay, let's decide on who's going to be the lead on what, so that you're not feeling overwhelmed, because people do feel overwhelmed when they have multiple practitioners. You know, it's hard.
Yeah. Can I ask a quick related question?
Yeah.
So you mentioned the microbiome with histamine intolerance, and I'm taking Visbiome daily, but it seems like prebiotics are going to be super important. I know you guys have a prebiotic that you really like. Can you talk a little bit about what to look for in a prebiotic, why you like your particular prebiotic, that kind of thing?
Yeah. The most common one that we use is like Back to Balance, which has sun fiber in it. I like that one because, one, it's like the easiest to incorporate out of the probiotics, and I see the best results with it. The other one that I really like is like we use quite often is psyllium seed powder is another good one. I like that one. The only downside is it has a bit of a taste. So it's not for everybody for that reason. And it's not easy to mix into things. So it's hard to get people on board with like incorporating something like that. Of course, there's always food too. You know, we always try to encourage people to utilize prebiotics in food. And then, you know, with Back to Balance, I'll put it in here, but there's a lot of good research on using it for a couple different reasons. With prebiotics, one of the main goals with IBD nutrition is to try to increase butyrate production. So butyrate is called a short chain fatty acid. So these are produced when our gut bacteria consume the food that we eat, and then they produce something called butyrate, which is a short chain fatty acid. And butyrate helps in a number of ways, one of which is to reduce inflammation within the gut. Another way is to help with healing the gut lining. So actually doing some repair to the gut lining, helping us utilize antioxidants better. There's a number of different things that butyrate is useful for. So, you know, one of the main goals with IBD is to help encourage the growth of that. So, you know, we don't really consume fibers. Like we don't digest them. Basically, our gut bacteria are the things that digest fibers. And so they feed off of that. And then we get these benefits from them. One of those things is the butyrate. The other reason I like it is it soaks up the excess moisture in the gut and kind of creates more of a gelling action, what I like about, so some prebiotics will help more with diarrhea, some will help more with constipation. Sun fiber actually is good at both. So you can utilize it in both realms. So that's the other reason I really like it. I've seen really good results. Typically in about like a 6-week period, people will see stool frequency and more stool form within that 6-week period. With a, you know, a good prebiotic like sun fiber is great for that. That's what I would say about it. Is Rebecca, do you have anything you would add around prebiotics or?
No, I think that was definitely well said. Just all those recommendations sound pretty good as far as really trying to, you know, repopulate the microbiome with healthier bacteria. And just knowing that, you don't necessarily have to get, probiotics from fermented foods. You can certainly get them in different areas. Same with prebiotics, you can get them from other foods. There's a lot of foods that have prebiotics in them. I'm sure a lot of us are familiar with FODMAPs and, I've heard that term. So all those FODMAPs they're prebiotics. So there's a lot of ways to get those in there.
Yeah. And sun fiber, another thing about it is it mixes really well into like liquids. So you don't, So there's no risk when it comes to like stricturing, and there's really not risk because if it's 100% soluble, you don't have some of the issues you might have with other complications with IBD. So I like it for that reason. And then I like it because you can throw it into tea and you don't notice that you're taking something. And so that's easy. But it is, we don't necessarily have too many people doing low FODMAP, but the other great thing about some fiber is that if you are perhaps going on that, it's still not in the FODMAP category if that was a concern. But yeah, so that's why I like it. I could talk about sun fiber for a long time, but I'll stop.
Awesome. Thank you guys.
Yeah.
I do have one other question that I can let other people
Yeah.
go.
Go for it. Yeah.
My other question was, do you guys have an opinion? I try not to eat a lot of sugar generally, obviously, because it's inflammatory, but and also for your gut microbiome. But do you guys have a feeling about pure stevia or allulose?
Allulose. Do you know what allulose is, Rebecca? I haven't heard of
Yeah,
that.
I feel like it's kind of a newer thing that people are using as a sweetener. So I actually haven't personally, I haven't seen a lot of research with IBD and allulose. Same with stevia. Like I haven't really seen any kind of, and Ashley, I'd like to know kind of what your findings are, but I haven't really seen too much even with stevia, or the same with monk fruit. There's definitely a lot with like certain gums are not really, beneficial for IBD. Like guar gum is one with colitis. And then as far as Splenda, sucralose, NutraSweet, those types of artificial sweeteners are not good, specifically because of how they interact with the intestinal barrier. So it creates more permeability, and the more permeability there is, or quote unquote leakiness, that's kind of what that can indirectly lead to a flare up. And so these artificial sweeteners have been shown to kind of cause that, but I haven't seen enough research in reference to stevia in causing that. And I haven't really seen much with allulose. Although
I think allulose is really new. Yeah. So it's like with artificial sweeteners, I'm still trying to understand like the mechanism of why they tend to be more negatively impacting the microbiome. But from my understanding, when you talk about like the real like artificial sweeteners that started out in the 90s, like the Splendas and all of those, I know in the mouth they're like much sweeter than regular sugar. Like I don't remember the numbers, but then our digestion starts in the mouth, and so we start secreting insulin based on carbohydrate digestion. So I'm not really sure like the mechanism of how artificial sweeteners are negatively impacting, but I know like too much of like lots of like sugar in the diet and lots of artificial sweeteners tend to have just a negative impact overall. It may just be feeding up gut bacteria, and how that tends to impact everything, because our gut bacteria, the more we can increase some of the more helpful populations by including more fibers and different things that will increase those species, but then we can also do the opposite. So I think it has to do more with how we feed the gut than anything. But yeah, there's not a lot on. All I know in terms of artificial sweeteners is IOIBD, the International Organization for IBD, that was on their list of things to try to take out, or that are more correlated with flare-ups. So I know that. With stevia, I'm less concerned about stevia than I would be for like other artificial sweeteners, but there isn't a ton of info on it. I mean, it comes from plants. I don't think it's like, I don't think I wouldn't compare it to the same thing as like some of those other like Splendas and stuff. I think they're pretty different in terms of their makeup and how they're made. But yeah, there just isn't a lot out of that out on the in the market on like or research on terms of those particular sweeteners. I know like things like Olipop has stevia. I consume a lot of Olipop, to be honest. I haven't noticed like any huge issues with it personally. And, you know, I think it's all about how we use something too. So yeah, and how much is in things. Yeah, it'll be interesting to see if there's anything more that comes out about that.
Yeah, kind of the same with monk fruit too, 'cause that's pretty popular.
Yeah, monk fruit's in so much. I'm not sure, is monk fruit, what is that from? That's just from the fruit, right?
Yeah. It's like, is it a tropical fruit?
Yeah, it's the real name is, it's from China, Luhangao. Probably not pronouncing that right.
Luhangao or swingle fruit.
Mhm.
Yeah, interesting. But I'm curious to see what the future of these research articles will show us.
Right. Like how do you define like what in the makeup makes one harmful and another not? That would be interesting.
Mhm.
Okay. Does anybody else have anything else? Holly says thank you. Yeah, thanks for being here. Jem says, over time, is Humira hard on the kidneys? This is going to be a Rebecca question. She's the kidney go-to. Any issues with smoked salmon? Does the prep for colonoscopy degrade gut flora? Let's start with the kidneys. Do you know much about the Humira and its effect on the kidney?
So it's definitely more of a medical question for your doctor, because they're the ones that know about, side effects and things like that. I personally haven't heard anything as far as renal issues with Humira, but again, that's something to discuss with your doctor about. One medication in particular that I do know in reference to kidneys would be mesalamine, or, Lialda, for instance. I know that it's important to regulate, or at least, monitor your kidneys and the kidneys function when you're on that medication, since that's, it's being used to, the kidneys are our major filter system. So that's what helps filter out that medication. So in reference to your kidney function and Humira, definitely ask your doctor about that. If you have any concerns surrounding that, Jim, I would definitely just, maybe check your renal function twice a year, right? I mean, really, you should be getting it at least once a year. But if you're concerned or for any other reason, then it doesn't hurt to ask your doctor if you can just check it again. So that's with the kidneys. Any issues with smoked salmon? So Ashley, you want to take this one for smoked salmon?
Yeah. So smoked. Yeah, we've talked about this as a team a lot. So smoked. So some of the answer to that depends on how it's smoked. Like, are we talking, do you use like one of the artificial smoked flavors, or, how is it prepared? That's one question that we want to know. But in general, like with smoked things, like when you just think about smoking meats in general, we want to try to avoid, if possible. It's that smoking that tends to create more carcinogenesis in the actual meat itself, like the fats, and that's not even just in meats, right? I think it's also in vegetables. If you have like a fat on a grill and you're smoking, it can create more compounds that we don't want in food. So I would use some caution with smoking. And then with prep for colonoscopy, does it degrade the gut flora? I I don't think it makes like a huge impact as much as it feels like it does. Like it feels like it's destroying you inside. I know that for a fact. But like with any sort of laxative, you are sort of clearing out a lot, and it can be kind of rough on the gut, but probably not catastrophic in the long term. It just feels bad. It's not fun. Is that what you would say, Rebecca, or what do you have to say about those things?
Yeah, no, I would say the same thing. Like it's not, it's one day where you're really, you're kind of clearing out your system. So yeah, I mean you are losing some beneficial bacteria by doing that, but it's not like you're consistently on a laxative or it's a concern, because when you're done with that colonoscopy, you're going to go back to your your eating habits. You're going to have your fruits, your vegetables, your whole grains, and so you'll be able to kind of repopulate that. And it's like just kind of like what Ashley was saying, and also as far as what we're kind of recommending, that having the colonoscopy is just one-time deal for however long or next time you have to get it. So nothing to be too concerned about.
So I know we're at the 4:00. Do you have a few more minutes for a couple more questions, or if you have to go, that's fine too. Okay. So we have a couple more interesting questions. So one of them says, has anyone on this call ever had experience with radiation therapy and side effects with Crohn's? Yeah, so feel free to put in the chat if you have. I haven't seen except in colon cancer patients. I haven't seen much radiation specifically for Crohn's. Albie is asking, can you guys speak about strictures? Is surgery the only option? I mean, depends on what your doctor says too.
Yeah.
They know your strictures better than we do. Yeah. Do you have anything that comes to mind with that topic?
Anytime there's stricturing or narrowing, it doesn't necessarily mean that you need surgery. Your doctor will give you recommendations on what to try, medications to try. So, I mean, again, that the medication part, surgery part, that's really what your doctor is kind of, helping you to support with. From a nutrition standpoint, there are definitely ways to navigate strictures and narrowing with your nutrition. And, it doesn't mean that you have to stay on, liquids for the rest of your life if you have stricturing. There's ways where you can progress and, change up the textures as tolerated. So yeah, so having blockages and obstructions and things like that, having surgery is not the only treatment available for that.
Yeah. And with nutrition, changing the type of fibers is really the route that we take with that. And, we consider each person a little bit differently around stricturing, but, soluble fibers are typically more tolerable, especially those that are more soluble leaning and less insoluble leaning. And one thing that sometimes people do is just avoid anything at all with fiber, but that has some downsides in terms of strictures worsening or increasing the risk of them coming back. There was a study that looked at Crohn's and fiber, and they found there was a 40% less risk of flare in those that were continuing to include fiber. And they also looked at stricturing, which was kind of interesting. So they found that we don't want to just completely eliminate fiber for people with stricturing. We want to just modify fiber. We want to change the type of fiber, but we do still need fibers for inflammation reduction. So it is something where you want to, be cautious and work with someone on that, and not just guess, but you also don't have to completely eliminate everything. And then Mark says, best electrolyte drink when dehydrated from Crohn's. Do you have any favorites, Rebecca?
So for some of our patients that have J pouches, I've heard noon, am I pronouncing it correctly? NUN. I've heard good things about that one. And
On the chat.
yeah, and then the liquid IV, I've also heard good things about that one too.
Oh, that's a good one. Okay. Liquid IV. Yeah, I mean, it depends on how bad we did a blog on this topic. I would say that might be another thing to check out. Maybe I'll include that in the recap email with the replay. It depends on how bad how low electrolytes have dropped, or if they've dropped at all, or if it's more preventative, how much diarrhea you're having, how much inflammation. Sometimes I've had some really rough goes with electrolyte loss. And I've done Pedialyte when it's really bad, but I've done try to get like the clear Pedialyte. I've also done Earthland's Best. So Earthland's Best has a Pedialyte without food colorings, I believe. So I'll look for that one to share with you guys too. And if you're doing really bad, you may have to actually go in and get liquids and make sure that your levels are okay. Because if you start feeling kind of off or confused, you want to make sure sodium doesn't drop. Another thing that I've had somebody recently that she was so scared of being dehydrated that she just kept hydrating, and everyone kept saying, you're probably not drinking enough, so just drink more water. And she kept drinking more water, but the other part of the IBD is that it drops electrolytes, right? So one of the things that can happen is sometimes we can, overhydrate with water, and it can deplete out electrolytes. So she actually ended up with her sodium and potassium in a dangerously low spot. And that was kind of missed because people just weren't looking for that obvious thing at the time. But so that's something to keep in mind if you are low, just to make sure you're monitoring that. Okay. All right. I don't see any other questions. So yeah, thank you everyone for being here and for staying, all this time. I hope it was valuable for everyone. And I liked this format. I think maybe we should do it again. And some people.
Definitely.
Yeah,
Absolutely.
but yeah, it was great to see some familiar faces too.
Yeah, thank you all for joining us today or tonight.
All right. Take care, everybody.
Bye.